You know, as we head into year 2 of COVID-19, which has led to over 500,000 deaths in the U.S. alone, the pandemic continues to take a huge toll on the minds of healthcare workers everywhere. What's happening? It's causing major burnout. Take a look. After over a year, healthcare workers are living the COVID-19 pandemic like no other group of people, and it's taken a significant toll on their mental health. A new study suggests more than half of doctors, nurses, and emergency responders involved in COVID-19 care could be at risk for one or more mental health problems, including acute traumatic stress, depression, anxiety, problematic alcohol use, and insomnia. The researchers found that the risk of these mental health conditions was comparable to rates observed during disasters such as 9/11 and Hurricane Katrina. As the death toll from COVID-19 rises, caregivers are exhausted and frustrated over not having the pandemic under control, which has caused severe burnout. Researchers say the pandemic's toll on the nation's healthcare workforce will play out long after the coronavirus is tamed. Our first guest is a mother of 6 and president and chief executive officer of the American Association of Nurse Practitioners, and who's dedicated to working on the front lines providing care for the underserved families in her community of New Orleans. So please welcome nurse practitioner Sophia. Welcome to the show.
Thank you so much.
Well, we're so happy to have you. So let's start right off, Sophia. What's it been like for you over the past year working on the front lines during the pandemic in New Orleans?
As a nurse practitioner, I can tell you it's been stressful. We are the front lines for caring for families, helping them cope and providing them with emotional support as they have sick family members. I've had a family that lost, I think, 5 or 6 family members. So it's been very, very difficult. And we're the patient's emotional support. At the same time, healthcare providers are definitely getting burned out and experiencing more anxiety than we ever have. If you think about it, we've seen more death and pain this year than we've seen our entire careers.
Well, I'm sure that's true. Judy, the burnout is there. Tell us exactly what happens to people when they burn out.
Well, Dr. Orden, what Sophia is going through is completely understandable. We're in this really unprecedented time where the community needs a lot of help and the people serving that community is going through the same trauma. We're all in this together in terms of COVID, but they have additional responsibility. So what we know about burnout is that it is a diagnosable condition, and this includes symptoms of overwhelming exhaustion, cynicism and detachment, and a sense of decreased effectiveness and lack of accomplishment. Over time, it starts to also correlate with symptoms of depression and also post-traumatic stress disorder or vicarious trauma. And what we know about the brains of people who are chronically burnt out, especially our frontline workers right now having to deal with so much, is that they start to have more difficulty regulating their own emotions, especially in response to negative events that they're encountering. They also have a higher risk of a number of chronic physical conditions, including coronary heart disease. And finally, they have an increased fight or flight response that doesn't appear to be tempered. And so they wake up in the morning, they have elevated cortisol, and they have elevated cortisol throughout the day. They have elevated blood pressure, even when they're at rest, not just when they're working. And all of these things can actually wreak a lot of havoc on all of your brain and your body and, of course, your mental health.